Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Maria Trillo. Today on the program, authorities are tracking down the close contacts of the country's fourth case of the Omicron variant. Officials are flagging a rise in the number of COVID-19 cases in some Metro Manila cities and other provinces. Also, some hospitals are swamped with patients suffering from diarrhea and a threat of pneumonia outbreak in some areas hit by Typhoon Odette. Health spokesperson Maria Rosario Vergeire joins us live. Now that the country has a fourth imported case of the Omicron variant, authorities are on the move to contain its spread ahead of the new year. The 38-year-old patient is due for a retest today since she was discharged right before the detection of the variant in her sample. She tested positive for COVID-19 on December 14th, eventually became asymptomatic and was released from an isolation facility on December 24. But she's still in isolation at home. Authorities are now looking for her close contacts. The woman arrived from the United States via a Philippine Airlines flight on December 10th. She initially tested negative in an RT-PCR test before her flight, but had a sore throat, itchiness, and a cold on her fourth day in quarantine.
We're still trying to coordinate with BOQ and DOTR regarding the manifest of this flight. Rest assured na lahat naman po ng dumarating, kapag dumating po sila, for example, coming from US, a yellow country, they are all quarantined for 5 days, tested on the 5th day. Once negative, they are sent home, but they have to do home quarantine until the 14th day. So lahat naman po ay sumailalim dyan, pero kinukuha pa rin po natin yung manifest so that we can monitor, especially those close contacts.
On the same day the country records another Omicron case, the health department also announces that it will no longer publish the daily COVID-19 count starting January 1st. The DOH says it wants to streamline public communication. All data can still be accessed through the DOH website. But lawmakers say this is not the right time to hold off on the daily bulletin. Senator Richard Gordon says the DOH should delegate it to other agencies if they're lacking in manpower. 318 new infections and over 9,500 active cases were logged on Monday. These exclude data from 28 laboratories. The positivity rate, or the percentage of Filipinos testing positive for COVID-19, is steadily increasing for the past 5 days, but it is still within the World Health Organization's benchmark of 5%. However, health officials are flagging an uptick in cases in these areas, including 5 cities in Metro Manila. The Octa Research Group sees no need to tighten restrictions just yet, but urges everyone to keep their guard up.
We have now reclassified NCR as low risk. Now it went up from very low risk to low risk. So it's not yet at an alarming level, but it's something that we have to monitor, and it's something that we have to be mindful of, that there are still COVID cases and the virus is still out there, and that even as we enjoy the holidays, the rest of the holidays, we should still practice minimum public health standards to prevent any serious surges from happening.
A hospital in the island of Siargao has been swamped with patients suffering from diarrhea after Typhoon Odette left them with no access to clean water. People also face the threat of a pneumonia outbreak. Chrissy De Matulak tells us more.
Here in Siargao District Hospital, most of the patients here are children who are suffering from diarrhea. Since Typhoon Odette, people have been having a difficulty accessing clean water. There is only one generator set working, but it is not enough to power the whole place. The hospital management here in Dapa, Surigao del Norte says that since the typhoon hit, a diarrhea outbreak ensued. And now people are starting to flock for pneumonia-related concerns. The facility is capable of handling only a limited number of patients, but now forced to cramp more than 120 patients. Patients recall their traumatizing ordeal during Typhoon Odette's onslaught. They also recount what brought them here and how they're coping with its aftermath.
Kami mag-asawa, talan, pag-aakos mi. Mamatay mi, dungan mi. Sakit naman ako kuto-kuto.
Parang hindi ko matanggap na kasi wala na kaming matitirahan. Tapos, dito pa kami sa ospital. Aywan, hindi ko alam.
Because of lack of beds, patients are advised to bring their own mattresses, beddings, and pillows. The hospital is also in dire need of IV fluids and diarrhea medications. Head physician Dr. Tan says they would appreciate if more health workers will volunteer and assist them.
Pagod na pagod talaga kami yung mga health workers namin kasi ilang days na ito na ganyan karami yung mga pasyente namin. Yung una, umaabot na nga ng 120, 110. Ngayon, nagmi-maintain pa rin, 90 patients pa rin yung nandoon sa, sa ward.
Aside from diarrhea and pneumonia, the hospital also has to deal with COVID-19. The facility has a limited number of antigen sets. The hospital admits it is not prioritizing COVID-19 related concerns at the moment. They hope not to worry about it, especially since there's already much on their hands. In Surigao del Norte, Chrissy de Matulac, CNN Philippines.
Let's go straight to the source of the story. Health Undersecretary and spokesperson Maria Rosario Vergeire joins us now. Ma'am, good morning. Thank you for being here. Let's start first with the fourth Omicron case the health department has detected, right? That is the country's fourth case of the variant. What else do we know so far about this patient?
Yes, ma'am. The fourth Omicron case detected was a 38-year-old female coming from the United States. She arrived here on December 10 via Philippine Airlines flight PR127. She had her quarantine for 5 days, and then she turned out positive. She had mild symptoms and was transferred to an isolation facility. She completed her 10-day isolation and was discharged on December 24 and now on home quarantine. She's currently asymptomatic, and we will be retesting her today to see if she has turned negative already.
All right, so she was released December 24, no symptoms, but without a negative test. Do we know if she is vaccinated against COVID-19?
I'm having gaps, ma'am. I did not get the question. I'm sorry.
All right, what do we know about the patient's vaccine status? Is she vaccinated against COVID-19?
Yes, the individual is fully vaccinated with Moderna vaccine. She had her 2 doses already.
All right, so now is this time of contact tracing. What should her close contacts be doing? Are they now required to undergo COVID-19 testing as well?
Well, we have already traced the contacts of this person. Her family, for one, her husband turned positive also. He is currently in the isolation facility. And then, of course, close contacts at home were all isolated. For the manifest of this flight, we are still trying to determine the close contacts inside the plane.
All right, how many close contacts are there, ma'am?
Again, ma'am, I'm sorry.
That's all right. How many close contacts does this patient have that you are still trying to get in touch with?
Yes, ma'am. The manifest is with us already. We're just trying to determine who among these passengers were in close contact with this individual. So we are going to apply the epidemiological definition of close contacts when, in terms of riding a plane, that would be 4 seats in front, 4 seats beside, and 4 seats at the back.
All right. Now, she came from the U.S., which is currently a yellow list country. Do you feel that there might be a need to include the U.S. in the red list, especially now that they are recording a big spike in COVID-19 cases there?
Well, we have metrics that determines what classification of a country will be. We do not add the presence of Omicron within our parameters because almost all countries right now have this Omicron variant already. We just need to determine if there is local transmission or community transmission already. Right now, we cannot close the borders. Having identified a lot of countries already with Omicron, what we are doing currently would be for us to strengthen our border control by ensuring that all incoming travelers will be strictly complying with the quarantine protocols that we have when they arrive.
All right. Now, ma'am, you mentioned earlier that the husband of the fourth Omicron patient also tested positive. Are you going to genome sequence his sample, or do you just automatically assume that he has Omicron as well?
No, we already have collected the sample from the husband, and we are going to subject this to genome sequencing as well.
All right, ma'am, remind us again, how long does it take to get the results of when you genome sequence a sample?
In the previous days or in the previous months that we started off with genome sequencing, we usually will have about 7 days time or turnaround time for us to be able to release the results for the genome sequencing. But right now, we're using a small machine from the Philippine Genome Center, which can run about 48 samples, and the results will be out in about 24 to 48 hours. What we are challenged with right now would be the submissions of laboratories in our epidemiology and surveillance units to submit immediately these samples to the Philippine Genome Center so that we can immediately process and release the results at once.
All right, I see. Now, Dr. Edsel Silvania, he says that Omicron cases are reported in returning travelers. And as it happens, the possibility of breakthrough community transmission becomes greater and greater. And he says it's likely to be just a matter of time before this occurs. What are the preparations for the possible or maybe even inevitable community transmission of the Omicron variant in the Philippines?
Well, as we always say, no, it's not really a matter of the Omicron not entering the country. It is just a matter of time. It is inevitable, actually, because it has crossed borders already. It has been detected in many countries already, and we have incoming travelers, especially our Filipino citizens who are coming home. So the determination or the detection of this variant of concern or Omicron in the community will just be a matter of time. That's why we are trying to prepare our response, especially in our community, so that if ever, if and when this is already in our community, we'll be able to respond well and we'll be able to manage if ever the cases will be increasing.
Right, we're seeing countries in Europe, we're seeing the United States experiencing these surges because of Omicron. When it happens here, will it be as dramatic as it is right now in Western countries, and will we be able to handle it? Will our healthcare system be able to handle it?
Well, we were able to, the challenge of the Delta variant, the country was able to overcome this, no? Even though our healthcare system was really challenged during that time. But I guess we were more prepared than the previous increases in cases. Right now with this Omicron variant, I think we are well prepared, better than before. And what will be the most critical factor right now would be that a lot of our citizens right now are vaccinated compared to when we were having the Delta variant. Although there is this effect of this Omicron variant to the vaccine efficacy and effectiveness, but the experts are still saying it can still protect us from severe infections and deaths. So right now we are preparing, and hopefully we can be able to manage this increase in the number of cases if ever Omicron enters our community.
All right, man, we will be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, health spokesperson Maria Rosario Vergeire. Yusek, welcome back. Let's talk now about the COVID-19 cases. The DOH is seeing an increase in Metro Manila's positivity rate and number of new cases in the past week. To what do you attribute this uptick to?
Well, if we look at our cases right now, ma'am, and the uptick in the number of cases, we are looking at cases who had been exposed 2 weeks from today. So all of this number of cases that we have right now will have had their exposure 2 weeks from today. And this might be coming from the holiday rush. People went out, went shopping, had gatherings, reunion, and this might be the cause of this uptick in the number of cases. Although we are still monitoring, we need about 1 week still so that we can really determine if there is sustained increase in the number of cases in the country.
All right. Now, we spoke to Octa Research yesterday, and they said that we've been classified from very low risk to low risk because of this slight increase. Is it still safe to say that the country is under at least a minimal risk?
Yes, ma'am. Actually, most of the areas still have this classification of minimal risk, although the country now is at low risk. Our case trends, although have increased a little, but most of the areas still have minimal risk case classification, meaning their 2-week growth rate is still negative. Their average daily attack rate is still less than 1. And what would be most important would be that all over the country and in all areas of the country, our hospital capacity remains to be at low risk, meaning this uptick in the number of cases has not translated into our hospitals having higher admissions for these COVID-19 patients.
So when you are looking at this slight increase, what exactly are you closely monitoring in terms of the COVID-19 cases? What are you looking out for? And is there really a cause for concern at this point?
Well, when we try to monitor this increase in the number of cases, we look for clustering of infections. We look for the sources of infections of where these are coming from, either from the workplaces, from communities, from facilities. So we look at that. And also what we would be monitoring closely would be severe infections and those that are to be admitted in hospitals, because these are the ones that are at risk and would really overwhelm our healthcare system if ever. But for now, I would not like to alarm people. I would not like people to fear or to panic. What we all need to do, we should all be cautious and aware that cases are having this slight increase, and we should be recognizing the fact that the virus is still here. Although it's Christmas time, it's the holiday season, we still need to comply with our safety protocols and get vaccinated as soon as you are eligible.
All right, ma'am, given the information we have at hand now, what is the DOH's projections in terms of COVID-19 cases in the coming weeks?
Well, our projections have changed, actually. We had projections done until the end of the year that we will really see that cases will really go down. But now with this threat of the Omicron variant, we are now revising our projections based from this variant of concern wherein it has affected other countries and there was this steep increase in the number of cases in other countries. So we are now revising our projections, trying to see how much cases we can have if ever Omicron enters into our community. But if there is no Omicron, our projections until the end of January would be that cases would continue to decline.
All right, now the government is set to decide on a new alert level after December 31. That's just 3 days from now. What will the DOH's recommendation be?
Well, our recommendation, if it's going to just be DOH to decide, our recommendation will be that we retain the alert level 2. With the threat of the Omicron variant, although most of the areas in the country can be eligible already for alert level 1 because of they have high vaccination coverage, they have low case trends, and their hospitals are not full, and there are a lot of beds and capacity. But with the threat of the Omicron variant, we would just like to be cautious. We do not like to ease so much on our restrictions. We just want to have this safe level in alert level 2 so that we can still prevent the entry of this Omicron variant into our communities.
All right, ma'am, I'd like to talk about the DOH bulletin. Can you tell us the reason why the DOH will stop issuing the daily bulletin starting January 2022, despite the Omicron threat and the slight uptick in cases in the country?
Yes, ma'am. Thank you for asking that question. I'd like to clarify to the public. I think there was this confusion yesterday. We are not going to stop to provide information to the public. We are just going to stop issuing out the case bulletin. The case bulletin contains our daily reported cases and the other details. And based on our assessment, we found that most of the details within this case bulletin that are included in the case bulletin are not so much useful to our citizens anymore. What they really would like to look at every day would just be the number of cases, maybe the number of deaths, but the main messages towards the bottom of this case bulletin is not really being appreciated. So what we did, we tried to re-strategize and discuss with our team. And now what we are going to do, we will stop issuing out this case bulletin, yes, but the information will not stop. We are referring people to our DOH COVID-19 tracker within our DOH website, where completed information are there. All of the details in the case bulletin is there. But what we are going to do also would be to issue out advisories every day, where the daily reported cases will be included and there will be condensed analysis. What we are going to give to the public right now when we start by January 1 would be the analyzed data so that they are better guided and they might appreciate it better rather than getting actual or raw data, wherein the main message for this specific situation is not really perceived as to be useful. So that is what we are going to do. Again, let me just reiterate, we are not going to stop providing data or information. We are just trying to reformat and re-strategize so that the citizens can find our information more useful through our social media platforms.
All right, so you will be issuing the information on a daily basis, but in a more analyzed form, and all the information will be available on the DOH website. But we have a reaction from a netizen on Twitter, I believe, at I'm J Trabuco, and he's saying mahirap daw i-navigate yung website nila na yan, hindi daw user-friendly, at nagtataka lang ako if posting COVID-19 case bulletin eats up significant time, resources, and efforts of the concerned DOH office para itigil na nila yon. Does it require a lot of manpower to put out this information, Yusek?
Actually, meron po. We have a team doing this. It's not actually the manpower because we will always do work. That's part of our job. What we are trying to do is to re-strategize or to reformat because we feel yun pong information that we give, hindi masyadong nakukuha ng tao yung mga main messages na kailangan natin makuha so that we can better guide them on what to do during this time of the COVID-19 pandemic. So we are not really going to stop the information. Again, I like to reiterate, we are just reformatting this so that we can better provide information in an analyzed manner and better guide our public.
All right, ma'am. So what will the new daily updates look like compared to what they look like now? And how will it be easier for the public to digest the information?
Well, previously you'd find, for example, you'd find number of cases, number of recoveries, deaths, you'd find positivity rate, how much were sampled, you'd find the number of beds that were occupied. But in this advisories that we will be issuing out, it's in the form of an advisory. The format of an advisory will still provide the reported number of cases for that day. But after that, we will have a brief analyzed data that we'll be providing to them. So for example, if positivity rate is 1.3%, we will tell them that for this past week, this 1.3 has been our positivity rate compared to the previous week, which was at 0.9%. And that means this and that. So there is this analysis already so that they can be better guided. And the main messaging would be captured by our citizens so that they can be better directed on what they should do.
All right, ma'am. Again, we'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, health spokesperson Maria Rosario Vergeire. Yusek, we don't have a lot of time left, but I do want to talk about the illnesses in the aftermath of Typhoon Odette. There's an uptick in cases of acute gastroenteritis and diarrhea in areas hit by Odette. What are the plans of DOH to help hospitals and residents in these communities?
Yes, ma'am. No, so we started off giving out our assistance already. And we have deployed our epidemiologists to check these incidents of diarrhea and gastroenteritis in these specific areas affected by the typhoon. We have provided already jerry cans where they can store potable water, as well as providing chlorine tablets so that we can somehow disinfect the water source from the areas. We have coordinated also with the local government so that we can provide appropriate potable water for cooking and for drinking for all of these residents in temporary shelters. What would be most important also is to maintain the hygiene and cleanliness in the specific temporary shelter so that we can prevent this kind of infections.
Yes, that's right. Those people have so much to deal with already as it is. Ma'am, thank you for your time this morning. We appreciate it, as well as your clarifications. That was Health Spokesperson Maria Rosario Vergeire. And thank you for joining us here on The Source. I'm Ria Tanwaco Trillo. You're watching CNN Philippines.